Okay, we will cover now anemias. What is anemia? Anemia is actually not having healthy RBCs. And what is RBCs? RBCs are erythrocyte. We all know that it carries hemoglobin in it and supplies oxygen to the tissues. What is the normal number of RBCs? In men it is 4 to 5.9 raised to power 12, and in 3.8 to 5.2 in women, and it has 120 days lifespan. So if anemia is not having healthy RBCs for enough time, normal time is 120 days. If they break down before 120 days, it is also anemia would also be caused. So if there is low HB or there is low RBCs, then also anemia. So you should know what is HB. HB is a hemoglobin. It has heme group and 4 globulins. Heme has iron in it and 4 globulins: beta 1, alpha 2, and beta 2. Okay, this is RBC. It has hemoglobin in it and it carries hemoglobin and supplies the oxygen to the tissues. If there is some issue in our iron, if there there is iron deficiency, if there is any issue in globulins like in thalassemia, then anemia will be there. So first we will talk about iron deficiency. What is iron deficiency? Iron deficiency anemia is actually a nutritional anemia when patient is not taking enough iron. So if you are not taking iron, then it is understood that your HB will be low because heme group will be not formed as much because iron is deficient. Ferritin, what is ferritin? Ferritin is actually the stored form of iron. Serum iron, the iron in the blood. TIBC, the total iron binding capacity. Total iron binding capacity to which? Transferrin and transferrin saturation. What will be the blood film? Okay, now I will talk about iron deficiency first. Iron deficiency, there is decreased ferritin because there is no iron. So how it will be stored? There is decrease in its stores. Serum iron, obviously serum iron will be decreased. TIBC will be increased because if there is some iron present in a body, then it will bind to it and it will try to supply it to the HP. So TIBC will be increased. Transferrin saturation obviously decrease because there is not enough iron. Second point is anemia of chronic disease. There is a lot of people having confusion about anemia of chronic disease. In anemia of chronic disease, the serum iron is low, the ferritin is normal or maybe increased, TIBC is decreased, and transferrin saturation is normal. So how you will gonna retain this? First you have to clear about the anemia of chronic disease. What is the anemia of chronic disease does to your body? Anemia of chronic disease, there is macrophages that will trap your iron. Iron is trapped in macrophages. So iron is available. Iron is available in the body, but it is not available to incorporated in the HB, right? So ferritin, iron stores will be normal or maybe high. Serum iron is decreased because it is not present in the blood because the iron is trapped in the macrophages. Why macrophages trap iron? Macrophages trap iron because there is anemia of chronic disease means you are having any inflammation or any infection, prolonged infection, chronic infection, then macrophages will trap the iron, so it will not provide enough oxygen to the bacteria or any other thing that is causing you that is in your body for prolonged time. So that's why TIBC will be decreased because it will not carry oxygen because it thinks that a lot of oxygen is present in your body. So why would attached to it, and transferring saturation will be normal. So it is normocytic, normochromic. Normochromic means the color will be normal. Normocytic means size will be normal, and color chromic means color will be normal. Sideroblastic anemia. Sideroblastic anemia is ferritin normal, serum iron increased, normal TIBC, anemia. So you will ask me that why serum iron is increased and how you will gonna say that it is anemia. First you should know what is sideroblastic anemia. Sideroblastic anemia is here. Sideroblastic anemia is actually the defect in the heme synthesis. Alright, it is a hereditary defect. It is hereditary defect. So there is iron available, but it will be not incorporated into the heme. Here, iron is available, but it will not incorporated into the heme. So there is faulty HB. So no normal HB not available to the RBCs. So anemia will be take place, as oxygen is not provided to the enough oxygen is not provided to the cells. I think you got all this. Okay, now the fourth point is thalassemia. In thalassemia the stores are normal, iron is normal, TIBC is normal, transferrin is normal, everything is normal. What is the problem? The problem is globulin chains. If it is in alpha chain, then it is alpha thalassemia. If the beta chains are faulty, or there is a point mutation in beta chains, then it will be beta thalassemia. So that's why there will be faulty HB. So no HB, normal HB will be decreased. So if there is normal HB decrease, then anemia will take place. I hope it is clear to you all. If there is any question, any query, if I said anything wrong, kindly correct me, and do share with the people who are facing the problem in retaining all these topics. I hope it will help you in your exam.